Notice that also the body mechanics result in vastly less effort for me. I'm just relaxing my knees for my pressure rather than pushing with my shoulder girdle. That's really critical. Working down the sacrum and then starting to work into the lower back. We talked about layers of muscle. There's 3 layers of muscle in the lower back. And what I want to do is come into the sides of them. And in a sophisticated approach to back massage, what you learn is that if you're going to address the back muscles, you need to come in not onto the back, but you actually need to come into the side. And I'm addressing not only the erector spinae, but deep to it, the muscle called the multifidus. And then deep to that, the muscle called the quadratus lumborum. This starts to then really substantially reduce the back tension that people are walking around with, whether they're athletes or older people or just anybody. And most people are tense in these muscles. It's like most people's backs are problems waiting to happen, unfortunately. The next thing we do is come up to the level of the back muscles that are just at the bottom of the rib cage and going all the way up eventually to the back of the head. We call this ironing up the erectors because this works with kind of smoothing out the out of shape or out of kinky feeling that we get in the back at the end of the day when you just feel that tension lodged in your back. So this just irons it out and smooths it out so that we're adding length to the whole spine. Later in the session I would also work with lengthening the front torso so there's really a 3-dimensional sense of decompression. And then I come in underneath the shoulder to kind of open up the front of the shoulder girdle, through the back, and here through trapezius and a deeper muscle called supraspinatus. And often I'll do these strokes once, twice, or 3 times, depending on the amount of tension I find. As my partner says, oftentimes the deeper you want to go, the slower you need to go, which also is relaxing in terms of the pace for your client as well as you as a therapist. Oftentimes after working, the therapist says, you know, I feel so much better. And there aren't that many forms of health care where you seem to actually feel better as a result of doing it. In this case, you do inevitably feel better. So now I'm going to be working on the opposite side. You always work bilaterally. How's that pay?
Good.
As I work, I carefully watch my own body mechanics. And also, you talked about looking at kind of energetic issues. What I'm doing is I'm bringing my awareness right to where my elbow is. I'm not trying to kind of push my energy into them. I'm not letting their energy come into me. I'm really making a good meeting, good, clear meeting. And by having that visualization of good, clear meeting, it helps things be clear for both people, extremely clear from the get-go. So some of those ideas are ones that I've taken from zero balancing, which is a very sophisticated approach that you work with the physical structure of the body as well as the energy. And that's become incorporated with something that makes this demassage Lauterstein method quite distinctive. The more my heart is in my work, the more I'm thinking clearly about the anatomy, the more I'm relaxing my legs, the more I'm making a clear communication as well as manipulation with the hands, the more the person feels extraordinarily invited to let go from inside out. And that's really the goal. I can relax them from outside in, but that's not going to last. If they relax from inside out, they've gained a neurological skill. And everybody needs that ability to be amplified by their therapist. just a little introduction to looking at anatomy and looking at deep massage as we practice it. And it's a real honor to be able to present that level of work to you and to your clients. Big thanks a lot.
Thank you. That was great. This down the erectors.
Yeah.
Amen.